Joining us from our Abuja studios to take a further look at the health sector is the former president of the Nigerian Medical Association, Dr. Prosper Igboeli. Thank you so much for joining us on the news at 10.
Thank you, viewers.
Now let's begin with this issue of welfare. Do you think the allocation of 1% of consolidated revenue to the health sector can help with the demands of workers?
I think this particular issue falls short of expectation, and I think the result will be very minimal to affect any development in the health sector. I think the federal government and the public sector should inject more money into health so that the common person at the grassroots will benefit very much from any development in the healthcare system in the country.
And when you're talking about the grassroots, we're looking at primary healthcare, for instance, and there's been achievements made so far. What do you think can be done to sustain these efforts by the government?
The government needs to have some real input into the primary healthcare, which is actually the basic foundation for healthcare in any country. Preventive medicine is very much acclaimed all over the world as the best course to take to increase the people's awareness of health and then to decrease morbidity and mortality among the rural dwellers. And I think the three tiers of government need to work together to ensure that the common person gets the needed medical help. The medical health is accessible and affordable, and that the National Health Act should be put into action as soon as possible so that National Health Insurance Scheme should be embraced by the majority of the Nigerians.
When you're talking about health, when do you see Nigeria being certified polio-free?
I'm a scientist, and actually, because of the way Nigeria's health system is structured, it will take a long time. I do not think Nigeria should even get there in the next 2 or 3 years.
Why?
Our way of life, the environmental factors that are the issues that are preventing us from getting the best medical care to the rural dwellers. As long as we have the new area of disease burden coming up, and then our way of life not being controlled, the disease spread will continue to, the disease control will continue to evade the national public health system.
Thank you so much. The former president of the Nigerian Medical Association, Dr. Prosper Igboeli. Thank you so much for joining us on the news at 10.